Good evening. We begin with breaking news. 7 new cases of COVID-19 in British Columbia, bringing the total number to 39.
2 of the new cases revealed late today work at a North Vancouver care home where 2 other workers were infected earlier, and a resident with the virus has died.
Penny Defloss is live outside that care home in Lynn Valley. And so, Penny, 5 cases there now in total, including a fatality. Safety at that facility, clearly a major concern tonight.
And that's why healthcare workers are watching closely for signs that the illness may have spread. We're being told that anybody who has signs of illness is being tested, and the health ministry is already cautioning that we could see more cases as test results start to come in. And that has family members pleading that more has to be done to protect the frail, elderly people who call this care center home. How COVID-19 got into this care home is still a mystery after several days of investigation. A man in his 80s who lived at the Lynn Valley Care Center has died, and the first diagnosed staffer has now been hospitalized. 2 more healthcare workers are confirmed to have COVID-19, 4 in total.
It's a minimal improvement today.
Family members who had to step in to care for residents after a major staffing shortage say loved ones are now being fed and tended to, but need more.
Their directions are to clean, enhance clean.
We know that there were staffing issues, especially on Saturday and Sunday and into Monday at the Lynn Valley Care Center. Today, there were full complements of staff.
Infected staff from Lynn Valley worked at other facilities in the region, and some care homes are now taking the unusual step of asking visitors to stay away, even if they're healthy.
We're trying to err on the side of caution and try to be preventing the potential spread of the virus where we don't need to.
They also want the public to know that with some staffers home sick, those still on the job are working overtime.
You know, this is a very stressful time for families, but also for the people who are working within the care settings. You know, the people are working long days. They're putting in extra hours. They're doing their best to try to make sure that people receive the care.
With 8 coronavirus cases linked to this care center alone, 2 of them family members of a staffer, BC's top doctor says they're not taking the connections lightly.
Our goal and our focus is on preventing wider community outbreaks, and that is what we're actively every day spending our time trying to investigate, hunting for potential sources so we can break any chains of transmission and prevent any larger community outbreaks.
Penny, given they still don't know the source of the virus in the care home and the new community infections, are there plans to ramp up testing?
There are, and Dr. Henry tells us that it may vary from community to community, but they're looking at enhanced testing methods that would actually keep people with COVID-19 infections that are mild away from emergency rooms, for example, to keep those resources going. Dr. Henry also tells us that in the past 4 days alone, they have tested as many people as the first 2 weeks of the COVID-19 situation. And despite, kind of random testing throughout the community of sick people, they've still not solved the puzzle of how COVID-19 got into this facility, where 1 resident has already lost his life. Mi Chang.
Penny Defloss reporting live tonight from North Vancouver.